We want to bring in Dr. Anthony Fauci. He's the country's top expert on infectious diseases and has served as scientific advisor for every president since Ronald Reagan. Dr. Fauci, good to see you. Thank you for joining us.
Good to be with you.
I want to ask you about what you said today before Congress, that our system is failing. How so?
What I was referring to at the hearing was that the system of testing was originally designed for a doctor-patient type of interaction where you go into a doctor's office or a clinic with symptoms, and the reason you want to test is either you've been exposed or you have symptoms. That goes to a public health laboratory that the CDC made the test for. It works very well for that. But what it doesn't work for is if you want to do broad blanket type of screening to answer the question that so many people are asking, how many people in this country are infected? That system now is going to be up and running, I would imagine, really quite soon, probably in a week.
Will that be too late?
No, I don't think there's things like too late. But what we can do right now is the kind of what we call both containment and mitigation. Those are the things you do to stop spread. So therefore, I don't like to say it's too late. It certainly is not too late.
We had a viewer write in that her sister has a low-grade fever, she has a cough, but the doctor won't test her for coronavirus because she doesn't meet the quote-unquote government standards. What are the standards, and why can't she get a test?
Well, I must tell you, Norah, for sure that that is a misunderstanding of what the standards are. The standards used to be more stringent. They are much more relaxed right now.
Are you sure that that message is getting to doctors?
Well, obviously it may not be, because you're just giving me an example of how that message didn't get out. I think we need to do a better job of getting that message out. Hopefully my talking to you today will be going a step in that direction to get that message out.
We know the symptoms of COVID-19 are dry cough, fever, and shortness of breath. If someone has those symptoms, should they go to the emergency room?
No. Thank you for the question. They should stay home, call their healthcare provider, call their physician, or even call the emergency room and say, these are the symptoms that I've had. I'm staying home. What can I do to get a test? And then you will get instructed about what the proper, safe way to do that.
Dr. Fauci, America has changed so rapidly in the last week. When is life going to get back to normal? How long is this going to last?
You know, Norah, we don't know how long it lasts. If you look at what's happened in China, they went way up and they're starting to come right down now. The Korea curve is peaking. It's starting to kind of flatten out. So you usually measure in a matter of several weeks to a couple of months.
Well, Dr. Fauci, good luck with all your efforts, and thank you so much for the information.
Good to be with you, Norah.